Hey guys, welcome back to allornonelaw. This is quick internal medicine, and today I'm going to talk about EKG topic. Um, EKG is really very important for your clinical practice and for your USMLE or any board examination. Okay, guys. So today I'm going to talk about what about the R and S waves. How do they look? How do they change? What you call in left ventricular hypertrophy, LVH. If the patient has a left ventricular hypertrophy, what are the variations that you see in R and S waves? Because in a previous video we discussed what are the normal variations of R and S waves. Okay? And we came to know that if everything is normal means the calibration is correct, okay, but there is a change in the shape or a length of the R and S waves, we came to know that there are causes for that, like a left ventricular hypertrophy, right ventricular hypertrophy, myocardial infarction, that is a posterior myocardial infarction, WPW syndrome, dextrocardia. So now we're going to talk about the LVH, that's the left ventricular hypertrophy. So remember, now let me draw the axis over here so that it will be easy for you to remember every time. Okay, now we have the leads. This is the lead 1, lead 2, okay, and a lead 3. Then we have AVL, okay. So we're gonna talk about this. And then we have what you call V1, V2, V3, V4, V5 and V6, okay. V1, V2, V3, V4, V5 and a V6, okay. Just a simple diagram, guys. Okay, now hypertrophy of the left ventricle, what it causes? It causes, remember, the tall R waves. We know the basic rule, the R waves, even if they are taller, normally they are taller, they should not exceed the size of 25 millimeter. 25 millimeter, they should not exceed this size, and the depth of the S wave should not exceed 25 millimeter. Remember, okay, if they are exceeding in that particular lead means they are abnormal, that's it. But they are smaller in other leads. Remember, this is very important. The R wave will be smaller, lesser than what you call 25 millimeter in a different leads, but it's going to be tallest, okay, right, that it should not exceed 25 millimeter. That's it. Now let's talk about this. If the left ventricle has undergone hypertrophy, that causes a tall R waves in leads that look at the left ventricle. Now tell me, which are the leads that are looking at the left ventricle? Of course, it's a lead 1. Excellent. Then lead AVL, remember. And then we have lead V5 and V6. V5 and V6. So these persons are looking at what you call left ventricular, right? Left ventricle. Okay, but lead 2 looks at what you call at minus 30 to 150. That's why you should remember. Okay, guys. So these are remember. Okay, and reciprocal, that is a mirror image change of S waves in a leads that look at the right ventricle, V1 and a V2. S waves of V1 and a V2. Okay, now you suspect, if you want to say the patient is having left ventricular hypertrophy, then you should have one thing, that's R wave in V5 and V6 should exceed more than 25. So R wave and V5 and V6 should exceed more than 25 millimeter. That indicates the left ventricular hypertrophy. Or S waves, okay, S waves in a V1 and a V2, okay, exceeds what you call 25 millimeter. Again, as I said, below 25 is a normal, up to 25 is a normal. If they are exceeding more than that, then means it's abnormal. Okay, but remember, S wave in a V1 and V2, R waves in a V5 and a V6. Okay, they look at the left ventricle. So the total of the R waves in a V5 and a V6, okay, plus the S wave in V1 and V2, okay, exceeds 35 millimeter total. If they're exceeding more than 35 millimeter, then you can say it's gonna be left ventricular hypertrophy. One thing I would like to tell you guys, this is not the diagnostic criteria. Why? Because a young, thin, if the patient is very slim, okay, with a normal heart rates, they often have what you call R and S waves outside these limits. These can be seen physiologically in a young, thin person. Remember, that's why what you have to look, the other signs of left ventricular hypertrophy like ST segment and the T waves involvement, which we're gonna discuss in a later video. Okay guys, so you got an idea that what are the changes of R and S waves in a left ventricular hypertrophy. Thank you so much for watching this video. Take care, please thumb up and share our videos. Thank you so much.